Okay, let's hope this works. Okay. Hi, I'm Sam, and today I'll be talking about various concepts with respect to type 2 diabetes. So we're going to start off with prevalence versus incidence. Prevalence refers to the proportion of the population affected by a characteristic of interest. So here I'm studying the prevalence of type 2 diabetes among San Diegan adults between 2019 and 2021. So prevalence is going to be looking at the number of San Diegan adults with type 2 diabetes during this time frame divided by the total number of adults in San Diego in 2019 to arrive at a rate of 8%. Meanwhile, incidence is looking at the number of new type 2 diabetes diagnoses between 2019 and 2021 and dividing this value by the average population of San Diego adults in the time frame. And this would result in a value of 1.3%. Prevalence is also a product of incidence and duration, and it includes information about new cases and survival after diagnosis. When studying cause, incidence is the preferred measure of frequency. Now, both prospective cohort studies and clinical trials aim to collect new information from samples to make inferences about a population. However, a prospective cohort study does not introduce any changes to the environment, while a clinical trial controls the situation to better establish causality. For instance, a clinical trial assessing the efficacy of a weight loss drug will control its experimental subjects' diet and exercise levels while ensuring that they meet particular criteria to eliminate the influence of any confounding variables. As a result, researchers can more confidently determine if a factor is the true cause of an event, here that would be type 2 diabetes, in clinical trials compared to prospective cohort studies. We use measures of association and study results to mentally weigh the different likelihoods of an outcome among the exposure and control group. These measures help us understand the relationship between the two groups, such as how the incidence of type 2 diabetes may differ between diets with and without red meat consumption. In prospective cohort studies and clinical trials where the outcome measure is binary, association can be measured by relative risk and risk difference. Relative risk and risk difference both use these values of cumulative incidence of outcome on treatment and on control, which essentially calculate the proportion of the treatment or control groups that do end up getting type 2 diabetes. And relative risk is more of a division ratio, and risk difference is a difference between the cumulative incidence of type 2 diabetes among meat eaters and among non-red meat eaters. Okay, I think that's it.